Welcome to the Seasoned Sonographer, the podcast where experience meets education in the world of OB/GYN ultrasound. My name is Lynn Flamm, and I'll be your host. I'm a registered diagnostic medical sonographer with over 32 years of experience, most of that time in OB/GYN ultrasound. Through this podcast, I'm here to share insights, tips, and case studies to help you sharpen your skills and optimize your scans. Whether you're just starting out or you're a seasoned pro, this is the place to grow your knowledge and confidence. Let's dive into today's episode. Welcome to the Seasoned Sonographer. I'm your host, Lynn Flamm, registered diagnostic medical sonographer. October is Medical Ultrasound Awareness Month, a time to recognize the skill, dedication, and impact of sonographers everywhere. After 33 years in ultrasound, most of them focused in OB/GYN, this month holds a special meaning for me. It's a chance to pause and reflect on the incredible work we do, the technical expertise, and the compassion that defines our profession. The challenges and rewards of our field are what keep us coming back every day, from the joy of seeing a tiny heartbeat for the first time to helping guide care through complex gynecologic exams. We have the privilege of making a difference in the lives of mothers, babies, and women at every stage of life. This month, we're celebrating that impact, the science, the heart, and the humanity behind every OB/GYN ultrasound. As OB/GYN sonographers, we're often the first to see life. That first flicker of a heartbeat, the developing profile, or the reassurance of a healthy pregnancy. Those moments stay with our patients forever. Every image we capture has a direct impact on diagnosis and care. It guides decisions, supports physicians and midwives, and provides reassurance to anxious parents or women facing health concerns. Our job goes beyond the screen. It's about the connection. We combine science, skill, and empathy to help patients through emotional and defining moments in their lives. For this Awareness Month, I wanted to include the voice of another OB/GYN sonographer who shares that same passion for our work. I'd like to introduce Catherine Knapp. She goes by Kat for those that know and love her. Welcome to the Seasoned Sonographer.
Thanks for having me.
Kat, can you please give a little background on who you are and how you became a sonographer?
Actually, I don't know how I became a sonographer. It was just one of those things that kind of sounded super intriguing whenever I was looking into what I wanted to be when I grew up. I had a child at that point, and so I'd experienced ultrasound and just thought it was one of the most fascinating things ever. So SIU at the time was just starting their ultrasound program. So I literally was in the first class that they had. So I guess we were kind of guinea pigs for SIU. They've kind of changed certain things since then, but we went through the program and we've, learned every day since then. And I don't, you never stop learning with ultrasound. So I started my first job. I worked in Albany Med in New York, which was a 700 bed hospital, which was amazing for a first job, because, you learn a lot when you get thrown in the fire, pretty much. I left there. We moved back home. I'm from Southern Illinois. We moved back here. Let's see. I worked at the old Marion Memorial. And then they built Heartland Regional while I was there. So we made the move. I worked there. I worked for Dr. Hatchett for a short while, who's a urologist. And then and then I started working at Heartland Women's Healthcare. Worked there for 15 years.
You had a lot of OB experience and OB/GYN experience in women's health.
I've looked at a lot of babies. Left there, and I decided that I wanted to travel for a while. So I did the travel sonography thing for a couple of years, and I'm back in the area for a bit, and we'll see how long that is, whether I stay or, my gypsy spirit decides that I need to take off again. Who knows? But so I'm back at Heartland Women's Healthcare, scanning babies again. So
good. How many years have you been a sonographer?
I believe, I was trying to think about that this morning. I believe we graduated in 2000. So 25 years.
Yeah, you are a seasoned sonographer girl. You have some good experience to share. So since it's Medical Ultrasound Awareness Month, what does this month mean to you personally as a registered diagnostic medical sonographer?
I think Ultrasound Awareness Month represents a time to recognize and appreciate the role that ultrasound and sonographers play in healthcare. It's not just about the technology and the machines and the pictures, but it's about the people behind all of that. The sonographers, the radiologists, the nurses that help um, and use their skill and compassion to diagnose, monitor, and care for patients. I think it reflects a deeply human side of medicine that you don't get in other modalities. We're the first window into new life during pregnancy. We're a tool of connection. Like, we are the ones who connect the patient to what's actually going on. We use our expertise and our compassion to help alleviate some of the worry and concern that these patients have, when
Right.
they're concerned about whether we just found something, or with OB and women's health in general. And I've worked men's health as well, but women's health in general, between OBGYN and breast imaging, there's so much anxiety for each one of those patients.
Oh, yeah.
And we're kind of that in between of, you kind of make or break that experience for that patient. You need to, you can use your compassion and your, not your empathy, but I mean, sometimes your empathy, because you just find a mass, or you found something baby. So you use that to help these patients get through that moment. And I've always said that, if I know everybody coming into my room is going through something, and if I can make this experience just a little bit easier for them, then I've done my job.
All the things that you're saying are just so amazing. Um, it is more about not just the technical part, but the compassion and the patient interaction and how we handle, giving those preliminary reports to the physicians and things like that. Can you think of one moment in your career that reminded you why you love being a sonographer? Was there one, or is there just so many? I have trouble personally picking one, you know.
Right. Yeah, there are so many. There's so many. Just seeing the faces of a mom who struggled to get pregnant, actually seeing her baby for the first time. We do those cute little 4Ds where they actually get to see their little faces, and the just the excitement that they get from that. Finding an issue on somebody where it's still early and they can get it taken care of, those tiny, tiny little 3 millimeter breast masses that, now this patient, we found it early enough that they don't have to have chemo, probably because we found it so early. Um, just having the relationships you build with patients
Yeah.
is phenomenal. I have some of my best friends I met because they were my patients,
Right.
and we grew a relationship through what they were going through and how I could be there for them. Um, Same with my colleagues. I mean, you and I became friends because we worked together,
Oh, yeah.
like that would I have met you otherwise? I don't know, like, maybe. We have mutual friends, so that could have happened, but you build such a strong relationship with your colleagues and your patients, that
Right.
it's different than just meeting someone out somewhere randomly, because you bond, and you've had to bounce ideas and thoughts off of them, and you've had a bad scan that you needed to talk to somebody about, and that person was there to lend an ear, and you've done the same for them, so you bond over that kind of thing. My traveling experience has been amazing. I think people don't think about that with ultrasound, but being able to travel, and I got to go live in Hawaii for 4 months and get basically paid to vacation. It was amazing. I worked in West Palm Beach for 4 months, which was phenomenal, and then I got to do little things like Jasper, Indiana, which is a cute little town, and Mount Airy, North Carolina, where I could hike all fall and see the mountains and do all the things. Um, and just the people I met there that I would have never met.
Right.
Um, and it's just, there's so many, like,
So many opportunities to
so many
just make those
opportunities.
connections.
Yes.
I'm thinking of all those times we see those OB patients week after week for biophysical profiles, you do develop a relationship
I
with
do.
them and end up sharing some of your personal things with them as they're sharing with you. But yeah, it's an amazing opportunity to create those connections and not only just provide good technical aspects, but yeah, that connection with the patient is so important. So
Absolutely.
let me ask you this. So how do you describe the role of a sonographer to someone outside of medicine? Because a lot of people think that it's just so fun. Your job's so fun. You get to take pictures of babies every day. And yes, it is fun most of the time. And yes, we take baby pictures. But how do you describe that role to someone outside of medicine?
Whenever everyone tells me how fun my job is, I do kind of chuckle because, it we do have those moments. And again, I've made some of my best friends through those moments. But I do kind of laugh and say, well, when it's good, it's good. And when it's bad, it's really bad. Those positive moments you have with those patients, you also have very heartbreaking moments with patients. Luckily, there's more good than there is bad most days.
Right, right,
um,
right. So,
um,
what advice would you give to a new sonographer or a student entering the field in OBGYN ultrasound? What advice would you give a new sonographer in an OBGYN office, or if you had the opportunity to give advice to some students, what would that be?
First of all, I'd want to tell them that they're stepping into a rewarding and dynamic healthcare career. Like it is, I personally, because I've worked with a lot of imaging people, and I just feel like ultrasound is the most rewarding because you do so much hands-on. I've had the CTs and the MRIs, and you know, and I'm not discrediting anyone that does any of those because those techs are phenomenal people as well, and they are amazing at their jobs. And but the one-on-one aspect of our job, I mean, we are literally hands-on the entire time that patient's in the room. So I just feel I feel like that's so rewarding that you're there. And once you gain your doctor's trust, and you have to earn it, you have to earn that trust of each doctor. 25 years in, when I walk into a new place, I know that radiologist, I've got to earn his trust. I don't
Right.
expect them to just go, oh, she's here and she's been doing this for a while, so she must know everything. I'm going to walk in there and he doesn't know me from Adam, and my name and his name are going on a report. And, he's the one that's going to take the hit if I miss something. So I know I have to earn his trust. And I never take that as oh, he should automatically know that I know what I'm doing. He doesn't. Like every new OB doctor that walks into our practice, I might as well be a brand new sonographer to them because they don't know me yet. And I work to earn their trust that they know that I know what I'm looking at and talking about. And once you gain that, you know, life's pretty good.
It's like a well-oiled machine. That's when the
It's
magic
pretty good
happens,
once you
right?
earn that.
The
But you can't,
ultrasound, the diagnosis, the reports, the meshing with the provider, and getting those confirmed results to the appropriate physician is like magic.
absolutely. But I think the most important thing to make sure that new sonographers and students are aware of is they need to focus on their imaging quality. It's not just about getting a fun picture or getting through the protocol. Like, know your anatomy, learn your anatomy. If you know normal, my instructor told me this in school because I thought I needed to know every I need to know everything that could be wrong, because how am I going to know if it's wrong if I don't know what it is? I need to know all the pathologies. And she would always say, if you know normal, you'll know abnormal.
Right. That's what yeah.
And
And the
as a
more
student, I
normals
didn't
you
understand
see,
that. As a student, I didn't understand that, and I catch myself saying it all the time now. Like, just know normal, like learn normal, and once you know that, um, you know, you, the abnormal jumps out at you. Like you almost can't see it after
right,
you know you're normal. Um,
right,
you know, I think they need to know that they can't just rush through an exam and just to get through it, and to master their machine, learn those knobs, know what that machine does. Don't just use the presets and expect it to be the perfect image. Know your knobology, because
right.
you can make those pictures or you can break those pictures,
Right.
not every
Optimize the
patient.
imaging for the best quality, so for a more accurate diagnosis.
Absolutely. Also working on communication skills, they've got to be able to talk to patients. They've got to be able to talk to coworkers. They've got to be able to talk to doctors. And doctors, let's be real, are not the easiest people to talk to, especially depending on which type of doctor you're talking about. Some of the surgeons, some of the, they're a little more difficult to talk to because they think of things on a different level than we do. But building communication skills where you learn your doctors and your coworkers and being a team player and all of those things, it just, that's all important. You're not just there to do your patient and nothing else. Like the whole spectrum has to work together for it to actually work. And I think the most important thing is to never stop learning. Never think that you know it all, you've seen it all, you can't learn from somebody else. Like 25 years in, if there's something I don't know, I'll go ask the doctor. Or,
Look it
sometimes
up.
we all have this little toolbox. We all have different tools in our toolbox as a sonographer. So, if there's something I see you do, I'm like, hey, how did you do that? Like, show me that trick, because that's so cool. I want to learn. And if you come in and you're like, hey, have you ever tried this? Like, I'm not going to be upset with that, because that's probably one of the coolest things that I've learned today is how to get, optimize an image that I didn't know that button even did that. And I thought I knew all of that, but you don't,
Right.
there's always something to learn, studying, case studies, and going back and looking at your scans and reading the reports and looking at the pathology reports to see what that actually was. Like, because you saw something weird, you don't know what that is. If you never go back and look at that, you
You
still
missed a
don't know what
learning
that is.
opportunity.
You still don't know what that is. You just knew that it was weird. That's not enough. Know what that is. Learn from it. Um, and I don't, I think those are some of the most important things. But also take care of your body. Like, don't just, ergonomics are so important. And I preach it all the time, and I'm not always the best at doing it, I'll be honest. Especially in OB, it gets a little tough to use perfect ergonomics. But also, going to the gym, taking care of your body, getting massages when you need them, seeing a chiropractor if you're in pain. All those things are important. Because once you lose your shoulder, you're in trouble. So, luckily 25 years in, knock on wood, I've not had to have surgery. I've not had to have anything done. I don't really have problems. I live in the gym. Before I lived in the gym, I had more shoulder and wrist problems than I should have that early in a career. But once I got my habits formed, it when you build the muscle around those things, and I'm not saying you have to be a bodybuilder and be, addicted to being in the gym, but taking care of your body is super important, because this job, it doesn't look like it's taxing on your body. When you just watch someone doing an ultrasound, people kind of laugh whenever you say something about, oh, my back hurts, my shoulder hurts, my neck. But it's extremely taxing on your body, because you're standing in the same position. BMIs are going up every year. Let's be real. And that makes it tougher, because you have to use different muscles and push different ways.
And earn those images somehow, some way.
Because you still have to clear that baby. It doesn't matter. We still need to know that baby's okay, or, there's not a liver mass or whatever it is you're looking at that day. Vascular was tough. Vascular was probably the hardest thing I've done on my body, was when I worked for the vascular surgeon. That was because you can't, ergonomics and vascular, it's almost a joke.
Wow.
But I didn't think it would be that big of a deal until I did it. And then I was like, wow, that hurt. I was in more pain the year I worked for a vascular surgeon than I ever was working OB, which is insane to me.
Yeah.
But yeah, taking care of your body, taking care of yourself, taking care of your head, because you go through these things with your patients. you have a 38-week demise. That's
That
hard.
is the
That's hard.
worst.
That's hard. It's hard on them. It's hard on you. You're not, you know,
You're
I always
human.
feel that I'm not supposed to cry with them because this is their loss, but I'm there for them. So, you know, the hugs and the whatever. But I feel if I sob in front of them, that's not helping them out. So, you know, you kind of hold that in until I do anyway. Not everyone's like
Yeah.
that. Until I
Until
walk,
you're by yourself. Yeah.
until I
Until
walk,
you're by yourself. So
right. And then, you know, your next patient's a 20-week coming in for an anatomy and wanting to know what the gender is. So you've got to
right.
like rally that and like wrap it up, put it in a package. You can deal with
Yeah.
it later. But you have to deal with that later. You know, you do have to deal with it. You have to let yourself, have those moments on occasion. I've cried in the shower a lot
Yeah. Yeah.
over the years. Because you've got to let it out. And when you go home, you don't necessarily want to dump that on your family. So, you know, if you're just standing in the kitchen bawling for some reason because you've just had a day and need to like decompress, they think you're a little nuts. So like the shower is a great place to do that for me. I don't know.
Oh gosh.
You just go,
Yeah.
and I'm a very ugly crier, so I like to do that where no one can see it
Yeah.
if I'm going to. So, but you
There
know,
are
again,
days when it's not very glamorous for us as sonographers in OBGYN. And, you know,
for
even
sure.
the gynecologic stuff can be brutal sometimes when you know that it's not good. It's endometrial cancer is likely, or a big ovarian mass that's not good. So
Absolutely.
yeah. So I think you've kind of already answered my last question. In what ways do you think sonographers shape the future of women's healthcare? We've already talked about just educating yourself, keeping up with your CMEs, keeping up with the new technology. Um, Anything else of how sonographers help shape the future of women's health that you want to add?
Um, you know, um I just think that, you know, the best sonographers, it's it's a unique blend of technical skill, clinical knowledge, and human compassion. It's not, you can't have all or none of any of those. Like you have to know what you're doing. You have to have the right equipment. But you have to have that compassion and that desire to be there with your patient, walking through the fire with them sometimes, you know,
Yeah.
like you're doing biopsies and you're doing, because this is an OBGYN, well, some of it is OBGYN, we do biopsies, but, you know, when you do breast scans or like a lot of times working in the hospital, you're doing paracentesis and thoracentesis and liver biopsies. And, you know, there's a lot of downtime during those procedures where you're the only one in the room with that patient. Um, because the radiologist has done his part. He's popped out of the room. The nurse, if you have a nurse with you, because it depends on what's going on, um, they're kind of doing their own thing. And that patient's counting on you basically to be their hand holder and to kind of like talk to them through the process. And, you know, I mean, I've had patients who refuse to let anyone else be in there with them through their procedure because, again, we bonded.
Yeah.
And, you know, um, it's just, you have to have that desire to be that person with your patients. Because if you think you're going into this just to take pretty pictures and do the fun things and walk out the door at the end of the day, you're going into the wrong career.
Yeah.
Maybe go work for like a 4D place, which is fine. Because they have their place in the role, and you know, they have a place in society at this point too. But if you're wanting to do diagnostic and, you know, do that kind of thing, it's a whole different ball game. It's not just the fun things, and it's not the glory. It's not the glitter and sparkle and rainbows that, you know, a lot of people think
Oh, yeah.
OBGYN is. Um, and so as long as you know that going into it, and that's your, you know, we're in this for patient care. That's what we're all in this for, our patients. We forget that sometimes because, you know, that you get so busy and all the things are going on and they want you to, you know, but at the end of the day, we're all going into healthcare to take care of our patients. And
Right.
you have the patients that make you kind of ugh. Because they come in and, some people are really entitled and expect certain things. And, that's not what you're there for either. Because you do remember you're there for the medical side of things.
Yeah,
Um,
the
so,
diagnostic part is the most important part,
right,
unless you're working at a boutique place that,
right,
does the flimsy 4D stuff for an extra fee. But
right.
yeah, so you have an expansive knowledge of ultrasound in all specialties, really. I love hearing how each of us connects to the profession in such personal ways. Even though our daily challenges might differ, the heart behind what we do is always the same: care, precision, and purpose. So thank you so much for coming on. I've enjoyed
Absolutely.
this so much, Kat. I appreciate your time.
Absolutely. I think if I have one thing left to say to new sonographers,
Uh-huh.
I would just, my little speech to one would be stay humble, stay hungry, and take pride in the impact your images have on patient care. Um,
Perfect.
you're not just pushing a probe. You're telling a story the body can't put into words. Because if we don't see it, neither do the doctors. So always remember that part. Don't just take the picture. You're telling a story. So with your pictures, and I think that's an extremely important thing to remember.
Right,
So
right. Making a big difference in their care. I always think about the joy that we bring when we show the patient their baby with a heartbeat, the moment that the patient realizes that she is carrying a healthy baby. I'm reminded once again just how powerful our work truly is. Moments like that remind us why we do what we do, how much trust patients place in us during life-changing experiences. Of course, not every scan is easy. We work through technical challenges, limited acoustic windows, patient discomfort, and fetal positions that make us earn every image. Then there are the emotional challenges. When a scan doesn't bring good news, or when we have to stay composed while supporting a grieving patient. And there's the pace of our schedules, the demand for precision, and the constant balancing act between speed and accuracy. But we adapt. We learn, we grow, and we keep showing up because we know that each scan matters, and we are the bridge between the patient and the diagnosis, between emotion and information. Ultrasound has been used in obstetrics since the 1950s, and it remains one of the safest, most versatile tools in medicine. It allows us to image life in real time, without radiation, with incredible precision, and with the ability to guide everything from early pregnancy evaluations to complex gynecologic studies. And behind every beautiful image is a sonographer, carefully optimizing gain, focus, and angle to ensure what the provider sees tells the whole story. Whether it's a transvaginal study in the first trimester, a third trimester biophysical profile, or a gynecologic exam, every image is a reflection of skill, patience, and care. The rewards are what make it all worth it. Seeing that first heartbeat, watching a baby move during an anatomy scan, or catching a subtle abnormality that changes the care plan for better, or guiding a patient through a difficult scan with empathy and understanding. There's also the reward of mentorship, helping students and sonographers find their confidence and improve their proficiency in OBGYN ultrasound. Passing on knowledge ensures that quality care continues for generations of patients to come. Every scan tells a story, and we are the storytellers behind the screen. As we wrap up Medical Ultrasound Awareness Month, I want to thank every OBGYN sonographer listening. Thank you for your precision, your compassion, your dedication to the women and families we serve. Take pride in what you do. We are not just image creators. We are caretakers, educators, and advocates in women's health. We are the eyes of medicine and the hands that help shape patient care. Thank you so much for joining me for this episode of the Seasoned Sonographer. If you're interested in improving your OBGYN ultrasound skills and learning more about the field, make sure to subscribe to the Seasoned Sonographer on Apple Podcasts, Spotify, and YouTube. You don't want to miss any of the upcoming episodes. You can also connect with me on Facebook and Instagram at Sono Techniques Academy. Explore more educational resources on the Sono Techniques Academy app, or reach out via email, lynn@sonotechniquesacademy.com. I'd love to hear from you. If you have questions or topics you'd like for me to cover, feel free to reach out. This podcast is for you, and I want to make sure I'm covering the topics that matter most to you and to the ultrasound community. Until next time, keep striving for excellence in your scans, and I'll see you in the next episode of The Seasoned Sonographer. The information provided in this podcast and any accompanying materials is for educational and informational purposes only. It is not intended as a substitute for professional medical advice.